If they get it, they're going. Now let's make it real confusing with this last disease. Scrapie. Non-febrile fatal encephalitic disease of sheep and goats, characterized by pruritus, abnormalities in gait. In other words, they're showing neurologic signs. The big thing to remember is it has an extremely long incubation period. Okay? Intense pruritus, extremely long incubation period. What's going to differentiate it from pseudorabies? Pseudorabies and ruminants, they're dead. All right? A few days after they show the signs, they're gone. Scrapie, they can have this intense pruritus. All right? It's an extremely long incubation period, 1 to 7 years. And it doesn't happen in cattle. Yeah.
So, when I was reading this survey, I was confused, and I know it's caused by prion.
Yes.
And here it says that the spread of the disease could be by a contagion, but how would that? Because prions are normal proteins.
Right. The way that they usually get it, is by way of feeding animals foodstuffs or feed that have some animal byproducts in it. Animals that were infected by this. Right? Because prions, you can't really, keep them in check. So if you have animal byproducts in the feed, this is where you can pass this on. You're not going to have this in cattle. It's only sheep and goats. Extremely long incubation period. Right. Incubation period from 1 to 7 years. It's usually in mature animals. The period of illness can last anywhere from 6 weeks to a year. Alright, so nervousness, withdrawal, aggression toward other animals, all of that is neurologic. But the pruritus is bilateral. Which makes it different from other things. Okay. Pseudorabies, like you said, it's cattle. Alright, short incubation period. Fatal. Okay, scrapie, extremely long incubation period. Both of them have pruritus. This only happens in sheep and goats. All right. The pruritus is bilateral. So if I have a goat that has a severe dermatological problem and they're scratching, do I have scrapie? Well, if you had scrapie, it would be bilateral. Okay? Whereas if you had a derm problem, it could be spotty anywhere on the animal. Okay? If you had a parasite problem, lice, things like that, all right? These things would not be bilateral. Okay? So extremely long incubation, long course of disease, bilateral pruritus. The fact that it's a sheep or goat, those things are what's going to differentiate this from everything else. All right? And that's the only way you can be able to differentiate, because there's no antemortem test. You don't have lab exams. You can't evaluate the brain and the spinal cord, but there's no antemortem test. So the differentials could be pseudorabies, listeriosis, rabies, photosensitization, pregnancy toxemia, polioencephalation, any of the above. External parasites, any of the above. You got to go by the characteristics of the disease in terms of history. Been going a long time. It's sheep and goats, intense pruritus, bilateral, along with neurologic signs. Yeah,
Would this be more like a hurt issue?
it's gonna be a hurt issue, yeah. Definitely. Okay, yeah.
Is this one of the, I know that's, BSC, is this one of the diseases that's
It's
kind of a
kinda
bone
related, yeah.
meal?
We're
Like
talking about the same kind of thing.
common feeding bone meal and stuff like that, contaminated?
Yeah. Okay. Any questions? No, you put it in the handout. All right. You give it to you perfectly. All right. On new crops. Oh, you pay your tuition? Okay, just making sure. It's kind of service. It's kind of service. You don't pay your tuition. You get the notes, but if you haven't paid your bill, you don't get the repeat. Alopecia, edema, hemorrhage, and decided pruritus. All right, non-suppurative encephalitis, neuronal degeneration, eosinophilic inclusion bodies. All of that, pseudorabies. Like I said, remember, ruminants fatal. Swine, asymptomatic carriers. Ruminants have to be somewhere in close proximity to pigs to get this thing. They're not going to carry it to each other, they're dead. Okay? All right, you can vaccinate sheep, you can vaccinate swine. You cannot vaccinate ruminants for it. All right, so the only thing you talk about prevention is if you start talking about the swine. There's not a thing you can do for the cattle.
Yeah, you don't put them down because they're all gonna be dead, right?
Yeah,
Okay.
pretty much. But you're gonna put them down, you're not gonna just, take a couple of days and watch it have neurologic signs stumbling around and all that kind of stuff.
Yeah.
You're not gonna try to treat it by way of drugs, you're gonna treat it with acute lead poisoning. By way of bullet. Okay. All right. So, got that. We're straight on all of that. That stuff is pretty much, except the highlights that kind of went over, that stuff you guys can pick up just from reading. Okay. Really fast. And if we need to go over this again before the test. The test is what, Monday, Tuesday next week? Tuesday next week? Okay. All right, remember, the test is 80% me, and then you got 20% Dr. McKenzie, who comes in here tomorrow. Yeah, comes in here tomorrow. All right, so both of us on the test, so the test may take a little bit longer. Two things real fast before I start running through this review. One, exertional rhabdo. Okay, in terms of what it's going to look like, the clinical picture. All right, now, we said hot, swollen, painful musculature. Okay. The degree to which they are painful, all right, just kind of depends upon the severity and disease. I know I told you, yes, if you got one that's in really bad shape, you can stick your thumb in the musculature and just about knock them down. That's not all of them. That's the really severe ones. Okay. Now, that severity also is going to give you an idea on how you're going to treat it. Now, fluid therapy is pretty much relegated to those that show signs of myeloglobinuriae or really severe, quote unquote, tying up, okay, in terms of IV fluids. Depending upon the severity of the disease, in terms of the clinical signs, we may give NSAIDs on very mild ones. We may give NSAIDs and nasogastric tube and pump fluids and electrolytes in them. And then in the very severe ones, we're going with IV fluids. All right? If they have myoglobinuria, we have no choice but to go with IV fluids because we're complicating things by having kidney problems, all right, in this animal due to that myoglobin. All right? So not every animal is going to be as severe. But like I said, our treatment, how far we go with it, is going to be dependent upon the severity of the disease. The thing about resting an animal, stopping exercise, and restoring fluid and electrolyte balance, and taking care of pain, that's going to be consistent with whatever level of disease you have. Okay, those three things. It's just how you do those three things. We always want to stop exercise because a lot of people are going to think his horse is just kind of, well, just kind of sore from working out. Nah, it's not sore from working out. There's actual rhabdomyolysis going on. There's muscle being broken down. We don't want you to try to run them or work them out of it. Restoring that fluid electrolyte balance depends upon how off their fluid electrolyte balance is. Okay? And we're always going to give them something for inflammation and pain. And we got to remember that Banamine and stuff like that, we use that also not only to take care of inflammation and pain, but prophylactically in case and keep this from developing into laminitis. Remember, we can have laminitis and exertional rhabdo concurrently. Who knows which one came first? If we're showing muscle signs first, then we need to do something prophylactically so it doesn't end up being a foot problem. Because the laminitis can come about from any kind of imbalance in the body. Okay. On corneal ulcers, there's just the two things I noticed. Not that a bunch of people got them wrong, but those are probably the two things I saw the most inconsistency. Remember, we're going to, in terms of corneal ulcers, it's always going to be about taking care of pain first, which we know comes from ciliary spasms and all of that. So pain, atropine. We know we got inflammation, so we got to go with some kind of NSAID. We also know that anytime we have a problem with the eye, it's also a possibility of it becoming, well, you're going to have some level of uveitis. So to keep that from progressing, we've got to have some NSAIDs in there. If it is a stromal ulcer, we automatically know, all right, that we are not going to use steroids. If we are fluorescein positive, which we are going to be with a stromal ulcer. All right, in terms of etiological agents, we're talking about some people put antibacterials and antimicrobials. Kind of the same thing, but remember, we're worried about bacteria and possible fungi. All right, we're always going to be worried about any ulcer can spontaneously turn into a melting ulcer. All right, just because it's long-standing, because the sky is blue, because of Pseudomonas, any number of things. So we always prophylactically, if we have a stromal ulcer, we're going to use serum or EDTA or acetylcysteine, one of the above. All right. Surgical intervention is always relegated to like desmetaseals and things like that. Okay. But our theory and our approach are always going to be the same. Okay. All right. Let's see. Start from the beginning. Always mess this up. Failure of passive transfer of immunity. Yeah. I keep on saying failure of passive transfer. All right. Remember Remember, large animals always get their IgG, their immunoglobulins, by way of ingestion and absorption of colostrum. That's the only way for them to get it. Is there a small amount of IgM that they get in utero? Yes. It is worthless just about in terms of protection. IgG is the one that is most protected. You got IgG, you got IgA, you got IgM. IgG is the one that is most protected. They only get this by way of ingestion and absorption of colostrum. Across the board. All right? You can have poor colostrum, you have colostrum they didn't get to, or you can have colostrum they didn't get to fast enough. Poor colostrum can be younger animals. It can be because of premature lactation, all right, like we have in equines. It can be because of SQ toxicity. Even if you had it, if you had the colostrum, it would be poor, and you're probably not going to have any. All right. Secondly, it'd be because they didn't get to the colostrum. Okay. Some kind of problem with the baby. You can have a baby with a poor suckle reflex, vitamin A, selenium, vitamin E deficiency. You can have a dummy foal or a dummy calf. All right, they had poor suckle reflex. You can have cleft palate. All right, so the colostrum was there, but they couldn't get to it. All right, remember colostrum can be tested to see its concentration by way of looking at the specific graphic. Okay, so they couldn't get to it. All right, last but not least is they got to it, but they got to it late. Who knows? Could have been a mare, could have been an heifer. She ran off, didn't come back till later on. Could be that baby was weak as a consequence of a difficult parturition. Could be this baby had some congenital problems, corpus valgus or varus or contracted tendons or something like that, that it took them a while to get to it. All the above could have happened. All right, that they got to it, but they got to it late. Remember, we want them to have what they need really in the time of greatest absorption, which is in the first 6 to 8 hours. Our gut window is going to be 0 come 24. 24 hours out, gut window is 0. Remember, after that first 12 hours, absorption rate goes down. So it's not 100% absorption, and then 24 hours later, it's zip. No, it's starting to go down after that initial period. So if we have a baby that is 20 hours old, 22 hours old before they get colostrum, and we know it, then we know that baby's at risk. We got to check it out. Okay? Because it may have had enough differentiation in the gut that it can't absorb the amount of IgG that it needs. Right? There's no clinical signs of failure to pass the transfer. The only clinical signs are those diseases that they are more susceptible to because they don't have the protective mechanisms that they need. They're immunocompetent, but they have not been challenged, and they're not fast enough to deal with the challenge. Most commonly what we see is diarrhea, pneumonia, septic arthritis. Those symptoms are the ones that are most commonly affected. So the way we test for it, all right, remember the test of choice or the gold standard, all right, is what? What is it? Okay, radioimmunodiffusion. All right, it's a lab test, 24 hours. All right, stall side or whatever you want to call it, stall side test or out in the field, snap test. It an ELISA test, gives us ranges, all right, for any species. Now, for bovines, for ruminants only, all right, we can use a refractometer and check the serum protein levels. They're supposed to be above 5. That's indicative of them getting good absorption of IgG, but that only works for ruminants. GGT only works for ruminants. Okay, so treatment is going to be dependent upon how old that baby is, how deficient they are in their level of IgG. Equine babies are supposed to be at least 800. You want them to be higher, but they're supposed to be at least 800. Ruminants are supposed to be at least 1,000. All right, so if we're going to treat, depends on the age of the baby. If we catch it early enough, colostrum is the way to go. It's always the best way to go. All right. If we have deficiency later on and the absorption rate is down or non-existent, then we have to go with serum. And you use hyperimmune serum or plasma, any of the above, but you're going to have to go IV. Can you pump serum into the stomach and then hope for them getting good absorption if you pumped it in time? Yes, but the volume it would take to make up for the concentration of colostrum would be a waste of your time.